Well, my friends, this is a case of a adolescent boy, aged about 16 years, who has been suffering from cough for last 7 years. See the character of the cough, constant hacking cough, for which the adolescent boy has been in distress for last 7 years. I do like to prescribe mercurius. Previous physicians prescribed many medicines, homeopathic medicines. The list is calimure, ambragridia, phosphorus, sticta, drosera, sanguinaria, arsenic, natrum phos, etc. No mercurius they have given. And allopathic physicians are prescribed many medicines, and many allopathic physicians consulted about this child, this adolescent boy. And they have done already many investigations without any findings. However, I do believe the mercurius will improve the child because the symptomatology covering mercurius. The cough aggravates in the evening and evening to night. At present there is no salivation, but there is history of salivation in the past. I have repeatedly told the past history, which is the primary symptom. Nowadays there is aversion of bread, but there was a strong desire for bread in the past is a good symptom and a good indication. This is a primary symptom and this is the original symptom. And anyhow, some way, this symptom has been debated or changed. So primary symptoms are always important. The primary symptom salivation is found in the child. Now the tongue is large and flabby, moist. See the tongue. Show your tongue. See the tongue is very large and flabby, a little bit moist. So mercurius tongue, mercurius salivation, and the aggravation evening to night. See, more interesting, the other symptoms are sweat profuse, there is abundant perspiration, aggravates in the axilla, etc., and which is very offensive. So perspiration offensive, urine and stool is also offensive. So their discharges are offensive, is another symptom of mercurius. So considering the totality, the halitosis also a symptom of aureum-mate, carbobase, baptisia, mercurius, etc. So considering the totality, my selection is mercurius, not the other drugs which are prescribed by my ancestor physicians. My prescription is mercurius because the totality go in favor of mercurius. The tongue symptom, the modality, the salivation, the perspiration, the discharge is offensive, all symptoms go in favor of mercurius. So please try to select medicines rationally and judiciously, my friend, not haphazardly. Please ask in yourself, ask in your mind, which medicine I am prescribing and for what purpose I have given. I have given sanguinaria canadensis, but why? What? You ask yourself. Is there any frontal headache? Is there any aggravation from sun heat? So why the haphazard prescriptions? I do not know. So the physicians are trained today prescribe haphazard in haphazard way. No. This is not the right solution. This is not the right way. This is not the right path. The only one path, only one system, only one procedure to prescribe medicines in homeopathy, that is from case taking, analysis and evaluation of symptoms, interpretation of symptoms, considering from past history, present complaints, family history, personal history, and the general symptoms, and together I have corrected once again in a systematic way, in a schematic way, which is named myself Dr. Robin Burman's method of homeopathic treatment. Please follow my treatment. You will not fail. You will success. This much assurance I can give you boldly, strongly, and confidently, my friends.